Hi friends, this is Dr. Shashikanth, consultant orthopedic and joint replacement surgeon. Today we will discuss about ACL. ACL is Anterior Cruciate Ligament, which is one of the most common ligament injured during sports injuries. Ligament is like a rope connecting two bones, the thigh bone and the leg bone, which is attached inside the knee. When you have an ACL injury, immediately there will be swelling, pain, and patient is unable to walk. Later, they start feeling giving way sensation or instability while climbing down the stairs or running or walking on uneven surfaces. They also may feel knee is weak. Sometimes they also have swelling and pain multiple times. So what happens when you don't treat or how to treat it? If there is no instability, patients can be treated without surgery with muscle training exercises, physiotherapy. But if there is instability, they should undergo a keyhole or arthroscopic ACL reconstruction surgery. Because if you don't treat instability, they'll end up in cartilage damage, meniscal injuries and arthritis. So if you have an ACL injury, don't neglect it, better to get it treated. Thank you.